You are a nurse at the Hackensack Meridian Health in New Jersey, and you work in the emergency department. So my first question to you is, how does it feel when somebody calls you a frontline hero?
Honestly, it doesn't really register. I think a lot of us we've had this conversation that we don't really feel like heroes. We walk in to work and we do our job, we do what we can. And we understand what the job description is that we go in, we do the best that we can, and at the end of the day, we may save a couple of lives, and that can, I guess, quote unquote, call us a hero. But we really just feel like we're just doing our jobs on a regular basis. So getting the recognition of what we do, we definitely appreciate it. I know I appreciate everyone's acknowledgement of how hard we work and everything that we're doing, but we really don't feel like we're any different than anybody else on the front line. We don't feel like we're actually heroes. We just feel like we're doing our job on a regular basis.
I think you all are very, very humble, everyone that's working in the front line, and thank you for all the work you're doing. Namrata, I would love to know, when the first surge of COVID-19 happened last year, when we saw the worst of COVID, as we can talk about, you were actually an ICU nurse at that point. Later on, you went into the emergency department, where you still continue to see COVID-19 patients. How was it being an ICU nurse at that point, at the peak of COVID-19? I want you to take us through the journey of what exactly happened.
Yeah, so I started off on a med-surg unit when our first COVID patient came into the hospital, and that unit got converted into a COVID unit, and then I was redeployed into our COVID ICU. But I remember the first patient coming in and us, surprised that we had somebody coming in with COVID. And it really just exploded. There was the first day where we had one, and then the next day there was three, and then all of a sudden we came back after a couple of days and the entire unit was just full of COVID patients. Being in the ICU, when I got moved down there, I was working with a lot of travel nurses who had come from all over the country at the time to help us out here at like the New York metro area. And they were a godsend. We needed them at the time. We were so short on nurses and beds and room, and we really, our COVID ICU is a makeshift COVID ICU. We took a different part of the hospital that we weren't using because we weren't doing surgeries in that area, and we converted it into an ICU. And these nurses from all over the country, stepped up, helped us out, did everything that we could have asked them to do, and taught us a lot along the way. We all learned together about how to take care of these patients. In the ICU, definitely taking care of the patients in such a critical condition was new to me personally. I'd never taken care of patients that were so sick and needed so many interventions. And the team that we were working with were just phenomenal. It was incredible to see my colleagues, not just the nursing staff, the doctors, the respiratory therapists, the anesthesiologists, the housekeepers, dietary staff, the social workers, all of them, faced with this new uncertainty and not having real answers to anything, but coming up with solutions on the fly and on the spot. It was really inspiring. It was an honor to be able to work with everybody at the time. And even though it was hard and tough and very, very uncertain, and a lot of times it was great to be able to work with everybody and see just how quickly people can adapt to these kinds of situations.
And Namrata, while you were working there, what kind of things entailed for your job duties? What kind of things did you have to do around the patients?
So in the ICU, this was a new concept for me personally, was proning the patients. It's something that was recommended for patients that are intubated and struggling to breathe. We would take them and flip them from being on their back to being on their stomach. It's something that when you're in such a critical state, can throw off your hemodynamics. It can make you even more critical. So when we're trying to reposition these patients, it takes a whole team of us to make sure that all the tubes stay in place. Because these patients are also, not only do they have a tube to help them breathe, but they are also paralyzed and sedated, so they can't move, they don't know what's going on, they can't assist us in all of that. And so when we try to flip them, that was one of the toughest, I think, parts of being in the ICU, was just knowing that after we try to reposition them, that there is a chance that alone, that assistance that we're trying to give them to help them breathe, might they might not be able to tolerate it. And they may decline in the process. So it definitely took a team. There was at least like 5 or 6 of us all together that would just with one patient just to try to flip them over to give them a little bit more comfort to breathe.
Right. Namrata, usually nurses anyways have such a close interaction with patients. Being in the ICU of COVID and the story you just described to us, actually moving a person has a lot of physical contact. This may be a cliched question, but did you feel scared at that point when you were so close to the patients? Or do you still feel scared?
Honestly, I think, personally, I never had any fear about it. I think there was a point where, we recognized that we had team members that were scared, that there were people who had kids at home or had older family members at home, and they were scared that they would bring it home with them. And a lot of us, who didn't have those reservations, I guess, stepped up, and we were like, you have family at home that you guys are worried about, let us take care of these patients. And I happened to be one of those people who was younger, didn't have kids at home that I was worried about, I wasn't living with elderly people. So I, didn't feel as scared to do my due diligence and take care of those people. But there definitely were team members, and I empathized with them because it was terrifying at the beginning, not knowing what could happen, what if you got sick, if you had your own health conditions that you were worried about. It was scary. And then we also had team members that we saw getting sick. So it was also scary to see some of those things. But I think, at the end of the day, we recognize that that's part of the job description. We didn't sign up for a pandemic, but it came to us and we needed to deal with it. So a lot of our team members just stepped up and did what we had to do. So being close to the patients, it didn't really register, I guess, in my head that we were so close to them and putting ourselves at risk all the time.
You got your second dose of the vaccine today itself, and congratulations on that. Do you feel more confident? Do you feel more stronger going into the emergency department now?
I feel the same. Getting vaccinated didn't change the fact that we still have to wear our masks, we still have to do our due diligence, we still have to make sure that we're keeping ourselves protected. I do feel a sense of kind of like there's a light at the end of the tunnel now that we do have this vaccine out, that I have been vaccinated, that family members are starting to get vaccinated. It feels like there's a moment that we can actually take a sigh of relief, that there is finally something that we have to kind of help us combat this rather than just doing kind of like hand-to-hand combat with this virus. So it's definitely a breath of relief to be able to have it, but I don't look at it as a solution, like 100% solution, and now we can kind of roam free and not have to worry about the virus. It's just part of the toolbox for us to help fight this off.
Right. Namrata, when you're looking at these patients of COVID-19, there are very strict protocols in most hospitals in which they barely get to see their family right now, where, when the cases are coming down. Last year, around this time, nobody was allowed to visit them. Nobody could see their own family members. They were pretty much alone in the ICUs. You were a family for those people, all the nurses. You were the only people they were interacting with. How much pressure did you feel of that? And how did you get through those emotions of taking care of these very ill patients who may not have made it through?
Yeah, that was definitely very hard. I know I had one coworker who mentioned that when she was in the COVID ICU, I think she started off with about 4 patients at the start of her shift, and she ended with just 1 because the other 3 had passed away. I think the toll that would take on us to recognize that we were the last people that these people were going to be around, last people who, we were the last voices that they were hearing, we were the last people holding their hands, the last people taking care of them. It never, left the back of our mind. Like, that was constantly something that we were thinking about. It was pretty much at the forefront of our minds when we were taking care of these patients. And we did do everything that we could to make sure family could still, video call them. And so these people can still hear the voices of their family members. But it was hard knowing that, people were this sick and family members couldn't hold their hand, couldn't comfort them, couldn't see them. I know we did our best to try to update family members as much as we could, as often as we could. But even that is hard when it gets busy and family members were calling us trying to get updated and they couldn't get an answer because we were dealing with so many other sick people. It was hard. And I know trying to be, especially the hospital where I work, We have a lot of Latinos who are only Spanish speaking. So the language barrier and the cultural barriers were also there for us to try to take care of these patients and their families. And it was definitely overwhelming at a time, but I think, our team was resilient and they found very creative ways of making sure that we were still communicating with family, making sure that they understood what was happening. And then, I remember watching one of my colleagues, every patient that she took care of in the ICU, she had a full conversation with them. And that was just what the nurses did on a regular basis. We would tell every patient what we were doing to them. We would talk to them. We would play music, just to try to bring some life back into the room, because these people, as much as they, can't speak to us, they couldn't talk to us, they couldn't tell us what was going on.
Yeah.
That doesn't mean that they're not there. And all of the nurses that I worked with down in the ICU were cognizant of that all the time, that they interacted with the patients in a way that still made them feel like a person. And that was, I think, important, especially when we told the family members that that's how we were taking care of them, that, we're still talking to them, they're still hearing our voices, they know that they're loved, that they're being taken care of, and that, a lot of the nurses would speak motivational quotes to the patients. You're going to get better, you're going to get out of this, you're doing so great today, stuff like that, just to keep them uplifted if they can register anything that we were saying.
Right. How do you all keep your mental health balance when you have to, on everyday basis, go through certain overwhelming experiences with these patients?
I think mental health is going to be one of those things, especially for healthcare workers, that'll be an ongoing topic after even after years after this pandemic is over. There was a few of my coworkers that I had spoke to once over the summer where cases had kind of gone down a little bit, and we were finally able to kind of talk to each other about what we'd gone through. And a lot of us never got a chance to really reflect on what was happening and what we were dealing with. We literally would clock into work hard the entire 12-hour shift, go home, sleep, and then come right back in. There was no time to decompress. I know Hackensack has done a really good job of giving us resources and people to reach out to talk about the concerns that we're having and the feelings that we're having. But it's definitely something that's going to be a long-term thing and a long-term discussion. I know personally, I have my family, I have a dog, and, therapy is always there to use when I need it. So it's definitely something that I think we're going to continue having a long conversation about, just to see how to continue moving forward, knowing that we're carrying all of this trauma with us.
That's true, and understandably so. It's a lot to take in. How are the hospital's conditions right now, Namrata, and how do you compare them to last year?
They're actually, personally where I work, it's a lot less COVID cases, which I'm so grateful for. Last year, around March, when we had our first patient show up, like I said, it blew up. It went from 1 patient to 3 to 20 in just a matter of days, and now it's a different atmosphere in the hospitals where we know when COVID patients are coming in, we know how to take care of them, we know how to treat them, we know how to isolate them, we know what symptoms to look for. So it's definitely a different atmosphere. It's definitely a little bit more manageable. We don't have the influx that we did of patients like we did this time of year. And it's definitely been something where we feel a lot more prepared. We have, all the PPE that we need, we have the staff that we need, we have the resources that we need. So the pressure of taking care of such a large number of people all at once is no longer there, which we're grateful for.
And I'm grateful to hear that you have enough PPE there, because that was the biggest issue for hospitals last year. I just have only 2 more questions left for you, Namrata. The first one is, the spring break that just passed saw, people flocking to the beaches of Florida and other parts of the country. They saw people interacting and holding parties without masks on. You're somebody who sees patients every single day. You have seen COVID from day one. How does that make you and other nurses feel when you see people being so irresponsible?
I mean, it's definitely frustrating. It's us as nurses, my colleagues and I have discussed this as well. We're tired of the virus as well. Like, we wish we can take off the mask. We wish it wasn't a problem anymore. We wish we didn't have to take care of all of these things. We're all tired and frustrated and exhausted. So I understand the sentiment of, not caring anymore and not wanting to do the proper protocol of wearing the mask and washing your hands and staying socially distant. But I just urge everybody to continue being diligent. This virus, as much as we are seeing the light at the end of the tunnel, we're still in the tunnel. There's still a lot of work to be done, and there's still a lot of time left for us to go back to where we were during the holiday season. So I urge everybody to just continue wearing their masks, washing their hands, staying distant, and get vaccinated when they're able to do so. I can't blame people for wanting to enjoy their spring break, but I, would encourage everybody to just be safe, be smart. If you don't have to travel, if you don't have to be around people, just don't. Try to make that decision to not just keep yourself safe, but the people around you safe, just until we have this nipped in the bud and can manage it a little bit better. I know everyone's frustrated. It's been a long, hard year. It's just something that I feel like people, might start loosening their grip on. And I would hope that people still keep thinking about how that could impact themselves and others.
Yeah, and it's so important to also consider all you healthcare workers that are doing so much work just to curb it, and we don't want to increase these cases. It was a pleasure talking to you today, Namrata. I would love for you to give one last message out to your medical fellow workers, all of the people that are doing so much of a hard work right now to truly, curb this disease and get more people vaccinated.
Yeah, I would just say, I'm so proud to be able to say that I am a healthcare worker during this pandemic. Every single one of the staff in at least the hospitals that I work in and with the Hackensack Meridian, every single person that walks in through those doors, whether it's a nurse, whether it's a doctor, whether it's the janitorial staff, the dietary staff, the social work, I don't care who it is, every single one of them has done an incredible amount of work and sacrificed so much to be able to get us to this point. And I hope that every single one of them feels proud. I hope that every single one of them recognizes how hard that they work and that it's not going unnoticed, that we acknowledge it, that we appreciate it, and that we've created, this network of people who have experienced this pandemic in a very similar manner. And we've all found very creative solutions to overcome it. And we're, like I said, coming to the end of the tunnel, and hopefully we'll make it out of it and be able to just look back on this as a memory. But every single one of the people that I've worked with across this country that have helped us out and have been going through this, you are appreciated, you are amazing at what you do, and I hope you continue to keep working hard.